So I know I look super pale, like super duper pale, but this is just the best lighting I have right now. Today I decided that I would set a record straight. ECT, or electroconvulsive therapy, the shock treatment. I thought I would talk about those, my experience, and you know, common misconceptions and myths and facts and all that good stuff. So of course ECT is controversial. I'm on a website. I mean, some of them I know, but I wanted to make sure I knew the facts. So I went to health.com, and this is 10 myths and facts about shock therapy, so you could look it up if you want to. Okay, so we'll start with a fact. It causes seizures. People get scared when they hear the word seizure, because who wants to have a seizure? No one. But yeah, fact, it does cause seizures. It's not like you get ECT and then like, oh, you're walking down the street and you like start having a seizure because of the ECT. Like, it's not like that. Basically, they shock you into having a seizure, so they give you a seizure. And that's what kind of reboots the system in your brain. So that's the whole treatment, is a seizure. But you don't like get seizures afterward, if anybody thinks that. Some people say it's only for depression. That is a misconception. It's mainly for people who are very depressed and very suicidal. It's also used for bipolar people like me. I got it because of my bipolar disorder, but mainly because of the depression part of my bipolar disorder. So I was very, very suicidal and nothing was working, so that's why I got the ECT. Yeah, so it's not only used for depression. Sometimes it's used for schizophrenic people, and I know it's used a lot in older people too, with depression and like other issues, but it's not used only for depression, it's used for other things too. People say that it's only used in mental hospitals. This is also a myth. It can be used in regular hospitals. People go back for maintenance treatments. You don't necessarily have to be admitted into a mental hospital to get ECT. In my particular situation, I was a patient at this hospital, and while I was there, I was getting an ECT. So I was admitted, and then they decided to give me the ECT. I wasn't admitted because of the ECT, but I think you can get admitted because of the ECT. Like, if I were to get ECT again, I would be admitted just for a few days, just because they would have to take me off my meds and stuff, so all that jazz. But I'm not planning on getting it again anytime soon. Not that it wasn't helpful, but just right now I'm doing pretty good, and I'm not planning on getting it again, because taking me off my meds would be like a real big like fuck up for me, and I'm not looking for a fuck up. Some people think it's dangerous. That is a myth. In ways, I mean, I don't think it's a full myth, but in ways I think it can be dangerous if they don't do it right. I feel like they would do it right if they're doing it. In older times, the ECT was definitely very dangerous, and they didn't know a lot about it. So yeah, I would say that yes, it was dangerous back then, but right now it is very, you know, safe. They hook you up to an IV. Well, for me, I'm saying for what they did for me, they hooked me up to an IV. You know, they put the mask over my face. They, you know, cleaned my forehead and gave me like an EKG, all that stuff. You know, they cared for me afterwards. The one thing they didn't do that kills me inside is that they did not give me a mouth guard. If, for any reason, you would ever go for ECT, you want to make sure that you get a mouth guard, because when you're getting the seizure, you bite so hard down, like just like this, like clench your teeth so hard that it could actually break your teeth. So you want a mouth guard for that. And I didn't get one. At the time, I was just like, you know, I didn't even know. I knew, but I wasn't like consciously caring about myself at that time. So I wasn't like, I need a mouth guard, no. But now my mom was like, if you ever go back, we're having the dentist make you a mouth guard first. And I was like, good idea. I'm glad my teeth didn't crack. But yeah, now it's way more updated, it's safer, and you don't just like bite down on something and they just like, it's very different. So don't go by what you've seen in like the old time movies, because it's not like that. It can chip teeth and break bones. Again with the chipped teeth. They say that it's a myth on there, but it can chip teeth. It can chip teeth. But you have to use a mouth guard. and if you use a mouth guard, it will not chip your teeth. I'm reading it like right from the thing, so sorry, but. Doctors give patients muscle relaxants to prevent them from seizing violently. I don't remember muscle relaxants, but it was probably like in my IV. I just don't remember like hearing about it. So issues like chipped teeth and fractures have been almost totally eliminated. So the muscle relaxants, they help you from getting chipped teeth and broken bones, because when you have a seizure, you get mad violent. For me, of the memory that I have, I don't remember being strapped down or anything. Just my head was kind of down because they put these things on the temples and on the forehead. But I wasn't strapped down, so they probably gave me a muscle relaxant. Thanks for that. I don't want broken bones. It doesn't work. They say it's a myth, but I say it honestly depends on the person, because I have talked to psychiatrists before and they say, well, it worked for this person, but we didn't get quite the same result for this person. So you can't say that it works and it doesn't work. It's like medication. This medication worked for me, but it didn't work for you. ECT worked for me, but it didn't work for you. So you can't say it's a myth that it doesn't work, but you can't say it's a fact that it doesn't work. And it says here that this doctor, the doctor that they did it on, Dr. Kennedy says about 85% of patients have a full recovery after treatment. That honestly wasn't my situation. I don't know if it worked, but for me, like all it was trying to do was really kickstart the meds, and it made me extremely manic, extremely manic. And for bipolar people, that's what it can do to you while you're getting it, and then it calms down. But I think it definitely kickstarted my meds. I was taking the same mix of meds, and then they stopped it, did the ECT, put me back on the same mix of meds, and those meds worked better than ever before, and I'm still on a few of those today. I don't know, I think they helped in a way, but I don't think it was like, oh, full recovery. I don't think it's ever gonna be like that. It causes memory loss. Oh, this is a fact. This is a fact, this is a fact, this is a motherfucking fact. I got ECT in January. Right now it's December of 2014. I got ECT in January, last January, that just passed. So it's gonna be a year now ago that I got it, almost. And I lost a lot of my memory. I don't remember Christmas. I don't remember my birthday, which is in February. I don't remember a lot of the whole ECT experience. I remember some of it. I don't remember Thanksgiving. I don't remember the months during and before the ECT. And then in March, I remember things that happened in March, but I don't remember like before that. I don't really even remember September and October. So they say it's short term, but I mean, it's short-term months. I'm not really sure, but for me it was months. But you will not lose like years of like fond memories. Like it's not gonna happen that way. But you will, like during the time you're having the ECT, you will lose the memories that you have during that time. So that is a fact. It does suck, but for some people it's worth it. It's used to punish patients. Oh my god, I guess you probably know that that's a myth. I mean, I'm sure in the past, like Kings Park Psych Center, it's closed now. This is on Long Island by me, actually. And I heard that they used to do that to patients to punish them. They would shock them up. And you know, that has happened, you know? So ECT does have a bad reputation because of it, but it does not happen anymore. It does not happen anymore, and if it is happening, then those people will have some serious consequences. Where I was, they treated their patients very nicely. It was a little old man that administered it, and he was very kind to me. That's all I know about that situation. Okay, this is a good one. It's a permanent cure. Myth. It is not a permanent cure. It's not even a cure, it's like help, kind of. It's not proven to be a permanent solution, and I don't think it'll ever be a permanent solution. I don't think you could shock someone into being happy or other things. People do go back. I was actually supposed to go back for maintenance treatments, which means like 1 ECT a week or once a month. After I got the original 10 every other day, I believe I was getting them. Yeah, I ended up not doing that. But a lot of people do that because it helps keep them on track in the recovery and not relapse. So it's kind of an aid. I don't think it is ever a cure. I think it just helps. It boosts the system, as they say, in the brain. I think that's what it is. I don't think it was ever a cure, or ever will be a cure. Maybe someday. I don't like this one. It's a last resort. They say myth. To be honest, for me, that it was my last resort option. We had done everything, and it was my 3rd hospitalization, and I was getting increasingly worse, and we really tried everything, and a lot of different medications. Even my mom says that it was a last resort option. It was just like, okay, well, we can do this. You know, the doctors brought it up in a way that's like, well, this is kind of unorthodox, but, and we did it. And it was a last resort option. It's not a last resort option for everybody, according to this fucking website, but for me it was a last resort option, and that's just me, but I can see how it wouldn't be a last resort option for some people. My ECT treatments were definitely a very difficult time in my life for me. I was extremely manic, and I just remember like making a fool of myself 24/7. Really bad cutting episodes and all this stuff. It was very difficult, but it's a commitment, and it's something that is very hard for me. It was very difficult to get past. I'm still getting past. I'm trying to live in Christmas this year, as you can see by my tree, because last Christmas I was a mess. I don't remember my 17th birthday, so I want to make my 18th birthday bitchin'. And yeah, there's just a lot of things that come along with it. It's big. It is a big deal. And it's not a joke, and it's no longer for psycho crazies. Every person I have ever met, that I've told I got ECT, they were like, oh my God. They were like horrified. And then I was like, no, I only got 10 treatments, which to be honest, usually most people get 12 or more. I got 10. That's not even a lot. They were like, oh yeah, only 10. And I'm like, yeah, only 10. It's not that much. So the stigma for it is very bad, and it can be very helpful, and I've met people who are helped by it. I was helped by it. I believe that I was helped by it. So I don't have anything else to say. But thank you for watching if you endured this. If you got ECT, let me know. Bye.